Good to hear, and thank you so much for being here today. And it's an important and time-bound committee, and we have quite a lot of work to do within the 9-month time frame. And even though we have to take obviously a much wider view on autism than just education, I think it would be widely acknowledged that children's access to appropriate education is a huge part of how they experience the world, not just for children with autism, but I suppose all children. I'll be a little all over the map with this. I've quite a number of kind of questions that I want to put to you. I looked fairly closely at the policy advice paper number 5, which I know is it dates from 2014 or so, so it is a little outdated. But I want to ask a series of questions that come to, I suppose, the timelines around the provision of special education supports to children. So working off these 2014 figures, it was estimated that about 63% of children with autism were in a mainstream classroom, whether supported or unsupported. Would that proportion broadly be the same now, or has it changed greatly over the time period?
I feel it will roughly be consistent at this moment in time, Deputy. Yeah.
Okay, so I suppose, well, let me start with a few specific questions first. The average age of diagnosis, when, I know, an average is very crude, but at what age are children being diagnosed with autism? Because that affects a range of access to services.
Paula would take that, Deputy.
Yeah, Deputy, it really depends on the gender of the student, the young person. So we tend to see later diagnoses in young females, whereas in the male population they tend to be quite young. I suppose my experience, I'm a trained psychologist and I've worked as a teacher in early intervention classes and mainstream classes with children with autism, and I've also worked in children disability network teams, so I have a really good sense of sort of the issues on the ground and the holistic issues that crop up. But we tend to see students coming in with where risk factors start emerging early on, but they tend to start flag around 8 or 9 years of age, depending on the developmental trajectories of the young person. It's just, you know, you get to a certain stage where they're meeting their developmental goals, and then the developmental goals starting to widen as the social communications become more nuanced. And because autism is social communication difficulty, the gaps really start to widen at that stage. Whereas really, if you have some young people who are born with developmental delays, which would be presented with autism and other co-occurring complex needs conditions, you would tend to see that at a very young age. So it really does depend on the developmental trajectories of the children. So
I suppose that calls it the early intervention piece. If we're talking about children at 8 and 9, really we've missed the boat in terms of early intervention. The secondary question to that, well, is it a question at all? That there's obviously a complicating factor of disadvantage then. So I'm assuming that wealthier parents have access to assessments more quickly because they can go privately. And so we have a complicating factor then of disadvantage. And I suppose particularly in an early year setting, we know all of the benefits that are there in terms of language deficits and access to language within an early year setting. But I'll leave that because I'm sure it's not quite a question. Average waiting times for a diagnosis. How long are our waiting lists from the time that a parent puts in to try and when a principal takes one of those precious NEP slots, how long are we in general waiting for a diagnosis?
Really, I suppose it very much depends, but just for a point of clarity, NEPs don't actually assess children with autism. To have an assessment of autism, it requires a multidisciplinary team, and that is the remit of the Department of Health and the Children Network Disability teams to do that work. So it's just, so even if a child is flagged as having a developmental difficulty with their NEP psychologists within schools, their role is actually to signpost the parents in the direction of how they would apply for an assessment. Now, the issue of the waiting list really depend on geographically where the students are, but that's a matter for the Department of Health with regard to the waiting lists that are there for the CDNT teams. We wouldn't be privy to that information.
Weeks, months or years?
I would say probably the latter.
Yeah. Then I suppose, and these are all going towards that idea of, I suppose, first presentation to when appropriate supports are put in place. And you said maybe in around that 63% of children are still within mainstream classroom. And I just, for the benefit of the committee, I want you to talk me through the continuum of support process that will happen within schools. And again, I think there's a timeline issue, so we should be talking about classroom support, and then we should move on to school support, and we should move on to school support plus. But there's quite a process and quite an amount of paperwork involved in getting from one end of that continuum to the other. So maybe you might talk the committee through that process from the point of view of a school principal or a classroom teacher or an SEN teacher, and how long it takes a child actually to move through that process to get to the appropriate level of support.
I'll respond to that as well, Deputy. The continuous support model is a response to intervention model that was developed with the Department of Education, rolled out initially by our NEPS colleagues in education. In relation to the work that we do in the NCSE, we use that model, and we also use a multi-tier system of support model. So with the response to intervention model, you're right in saying that the schools track how the child responds to intervention across those tiers. So we have the universal tier, where we would have that expectation where the environment of the school would be adapted and supported to meet the needs of the person, of the young person. And then over time, the school, you know, in collaboration with leadership, the SET teacher and the SENCO or the SENO, whoever it might be, the SNA who are supporting the child, look to see how the child responds to that intervention over time, and that is tracked over time. That is the business of schools, to actually track that. I know you say that there's work involved in it, but there's been a huge amount of supports that have gone into schools to enable schools to track that support, to build capacity in schools. So in the NCSE, we have developed a lot of resources to help schools, to support them around that universal piece. So we have that sensory document that we have done, which really supports schools to understand the regulation needs of students. Our colleagues, our therapy colleagues within the NCSE as well, have also developed communication supports just around really adapting the environment to meet those holistic communication needs, because any of us that have come from teaching backgrounds that have taught children with autism know that really good interventions for students with autism are really good interventions for all children, regardless of what their need is. So there's a lot of universal supports that are there, that we can embed a universal design for learning approach which meets the needs for all students. So over time, some students will not respond to all those supports, and then they move to the school support plus, which means there'd be more intense supports for that student. In the NCSE, what we have is we have a lot of advisors that will go into schools. They can request for additional supports. We have advisors in inclusion and in behaviour that will help those needs. And then for the very intense supports, we would have the students can access behavioural therapists, because I know that behaviour is a big issue in a lot of the schools, particularly in our special schools. Yeah.
I suppose it was less a question about the work involved, because I don't think any of the schools are adverse to the work involved, but there is just quite an elongated timeline from when needs are first identified in a child to the child getting the appropriate supports. I think that universal design for learning piece needs digging into, but I don't think we can do it in 1 minute and 47 seconds. So I might ask, I might pivot slightly. That paper number 5, the policy advice document, the assessment of the July provision is less than sanguine in that document. And John, you emphasised there how important you now find July provision. I know you're new in the job, maybe a new brush sweeps clean, but can you tell me what has brought about the change in mindset in terms of July provision? Has there been changes in the actual model of provision?
Well, yeah, and I suppose from the department in their close consultation with parents in particular, in terms of the necessity of the July provision and the importance of it, and particularly to parents of children in special schools. And COVID certainly heightened the awareness for all stakeholders in relation to that. Obviously in relation to Ukrainian students and other students with emerging needs, the importance of the July provision, the importance of the stability and continuity of a regulated, consistent provision has certainly highlighted it. And I suppose sometimes when you look at policy perspectives and they become, they can look jaded or look nuanced in retrospection, many of those policy voices have stood the test of time in terms of 2015 when this document would have been issued and developed by the NCSE. Many of them have been implemented and progressed. As we've just been discussing there, further enhancements certainly can be taken on board, but I think the observations are very astutely that you picked up on in terms of July summer provision programme, and that's, I do know from engaging with the department, that's a particular initiative they're very much progressing.